I wanted to briefly discuss some of India's healthcare needs and relate those to those in the UK, to talk, as you say, Chris, about universal healthcare and the struggle to establish it worldwide, and then to consider in that context some European responsibilities and opportunities in respect of trade with India. So I hope that's a relevant agenda. India today, remember, you've got a population twice the size of the EU, nearly 4 times the size of the States, in about 2% of the world's health service, world's surface. About a fifth of the world's population is Indian. That's why it's important for a start. We heard this morning that it's still a relatively poor country in per capita income terms. Even if you move to purchasing power parity-adjusted figures, people in rural India have a true income of about 5% of that enjoyed in the average person in cities like London. India is now the world's largest producer of generic medicines. Its main profit centre is the States. You get a temporary period of effective patent protection if you introduce a new generic medicine in the States. That's how the money's made. So it's not sales to poor countries so much. But at the same time, several hundred million people in India. As Lord Kekar said, AJ, there's not a good primary care system, even though on paper the system isn't so bad. And many, hundreds of millions of people don't have reliable access to basic medicines and the rest of healthcare which goes with that. My interest, incidentally, my bias, will probably be, as I discussed with Chris, to the interest of the research-based pharmaceutical industry worldwide. I think I'm about serving global public interest in 2 areas. One, in access to effective technologies when we get them. So the outrage in the 1990s that we had drugs to treat HIV but weren't supplying them in sub-Saharan Africa where the need was greatest is something we shouldn't repeat in the future in the context of, say, cancer care. And I think I'm also about trying to defend world systems in encouraging investment in continued innovation. They're much more vulnerable than people think. So squaring that circle between innovation on the one hand and just supply on the other is what I believe I'm about, but anybody who thinks they're not corrupt is probably deluded. There, of course, is Manmohan Singh with Obama reminding us of the importance of that relationship. Those are healthy life expectancy figures for 2010. They're probably the best source available, although I think the Chinese figure is optimistic. They remind us that although huge advances have been made in Indian healthcare since the time of independence, remember that life expectancy was on average still under 40. Healthy life expectancy for men and women combined now about 55. That's a good deal of progress. It's better than England at the peak of its imperial power in the early 1900s. But there's still a long way, a big gap between that and a healthy life expectancy of 70 years. And one of the points I wanted to make is I think we're underestimating the importance of healthy aging. India fighting on 2 fronts, essentially. A big burden of infectious disease and a growing burden of chronic disease. Although remember, as populations age, and move more like this one, the actual age-specific rates of non-communicable diseases go down, not up. So, next one, that's a reminder. This is from the Wall Street Journal, written by Rod Hunter, who's a pharma executive who I know personally and greatly respect, but clearly exercised on what is billed there, I think inappropriately, as India's attack on innovation. There is a big underlying debate between rich and poor countries, richer countries and emergent economies about intellectual property, particularly important in the pharma context. I don't want to go into detail about that. I think there are rights and wrongs on both sides, and we've got a potential to damage public interests severely in both India and in Europe if we don't get this right. But I do want to flag it as an issue for further discussion. That's a picture of Indian demographic transition. A lot of this work is with my colleague Jennifer Gill from UCL over there. The population figure is that dark blue line. As you see, even at the time of independence, India's population was only about 300 million. Today, 1.25 billion probably. In the last decade, roughly, Indian population has increased by 250, a quarter of a billion people, 250 million. Christine suggested this morning that the demographics are on India's side. I'm not sure that's true. I think that looks like a potentially very big problem. And it's a problem which relates to, in my view, poor healthcare provision. We can see the delayed decline in birth rate, even though the decline in death rate was started well before independence. Not time this afternoon to go into factors behind this in great detail. Remember the perfidiousness of the British, obviously. The Amritsar massacre is a symbolic memory of lots of other abuses. But I think there are things about Indian culture. The fact that Hinduism survived, that we have a country with multiple deities, in a world where really monotheism is dominated because of the sociological significance of bringing cultures together, I think is hugely significant in relation to factors like difficulties in taxation, sometimes even various population groups, communities competing for space and for population. There are a lot of factors going on there. The one to emphasise this afternoon, though, is that apparent lack of popular demand for good healthcare systems. Overall, India spends about 4% of GDP on healthcare. Public services, about 1% of GDP on healthcare. This is below even Myanmar. It's well below the figures recorded now in sub-Saharan Africa and elsewhere. It could be population choice. I tend to think of it as policy failure and relate it sometimes to the federal structures and their relationships with the states. Remember, we heard this morning that some of those states, say Uttar Pradesh, population 200 million, that's bigger than Brazil. Many of those other states, bigger than Germany, bigger than the UK, even bigger than Belgium. Successes and failures. Let's ignore the successes. There have been important healthcare developments just in the last decade. To me, though, there's a sadness in that although there were planning commission promises about calls for extending universal healthcare, improving the supply of generic medicines, for example, which the country can well afford, it seems in the run-up to the election next year, India has invested in a food law reforms which the economic case for, the welfare case for, is very much weaker. The political case in saying if you're going to subsidise foods for 800 million people might be very strong. I think the welfare case for putting it into healthcare and really focusing on universal healthcare development as a priority, very much stronger. So there are real structural problems there in Indian democracy. I won't go into the carbon dioxide emissions figures there. Some Indian friends argue that global warming isn't their fault. India is currently the world's third largest producer of carbon dioxide. I think sometimes there are limitations in thinking about global responsibility, just as there have been limitations in thinking about national internal responsibilities, and just as there may be some limitations in the context of thinking about intellectual property. The figure on that slide shows you HIV, AIDS prevalence rates in India, and the country has done a good job, I think, on prevention, although there are questions about drug supply even now. The reminder is that situation at the turn of the century when we had effective anti-HIV medicines and were not ensuring universal world access was grossly unacceptable. Against that background, what are our collective global needs, responsibilities, etc.? We need to complete globally demographic epidemiological transition. We cannot sustain increasing human population in the context of the problems we now face just in terms of atmosphere alone. I think we've got a mutual interest in developing fair worldwide access to medicines, but doing so in ways which maintain our capacity to privately fund innovation, and private and publicly funding innovation are intimately linked. The two correlate strongly. They feed on each other. Don't think that governments will necessarily move in if you destroy your underlying private sector capacity to fund innovation in pharmaceuticals or elsewhere. We've got a mutual interest in developing technologies for defending the world environment from degradation or further degradation. We've got mutual interests in challenging corrupt practices, which we see not only in India. Look at the issues in China and British and other companies, although they, of course, were responding to a situation in which Chinese healthcare over the last 30 or 40 years has been woefully underfunded, and inappropriate practices have been almost centrally supported. So finally, what are the strategic opportunities that I think are there? I think we need to work together to respect universal access to healthcare nationally and internationally. One of the things that worries me is the lack of respect for active ageing. If we move in societies which move beyond muscle as the means of production to brains, the case for keeping older people and that valuable human capital investment going longer, and not overestimating the value of young populations, looking in the rear mirror instead of the forward direction, I think is extremely strong. So we've got mutual interest in understanding universal healthcare, and by and large, of course, healthcare spending goes up as societies develop. That's one area. We've heard today about the size of those states and the difficulties in federal relationships between the centre and the states. I think areas like Europe, countries like the UK, have got a strong interest in developing special relationships with particular states, although we must be careful of that cycle-down process in which the rich go richer and the poor go poorer. And then finally, the thought I wanted to leave you with, I think there are limitations in intellectual capital law globally. For me, terms of patent protection and other similar devices are now far too short to serve human interests, and at the same time, producers of genuinely innovative high-risk pharmaceuticals, which is what I'm particularly interested in, have in the past not been sensitive to need on a global basis. How can we square that circle, work together to improve a level of dialogue? To me, it's about extending terms of protection and extending the social responsibilities of innovators worldwide. That, I think, is a dialogue we could well have between India and the UK and other countries. We could lead the world in that. And it's a huge option for the future, when what we'd be relying on is the application of the biological and allied sciences to issues like climate change, food production, etc. So that's where I want to leave it, Chris. Thank you very much for the time.
Thank you. Thank you.